Hi, my name is Dr. Shalini Kamodia, and I'm a dentist at Gentle Dental Care in Vestal, New York. Today I wanted to talk to you about treatment for dry mouth. These recommendations will help the majority of people suffering from dry mouth, but in some specific cases you may need to see a specialist or be referred for additional testing to figure out what's causing the dry mouth. So if you came to me and said, I have a dry mouth, what can you do? This is generally the sequence of steps I'd follow. First, I try to figure out what's causing your dry mouth. Sometimes it's a medication you're taking, in which case we can talk to your doctor about changing it and trying a different brand that does something similar and avoids the dry mouth. It could be an underlying medical condition. You may have diabetes and not realize it, which can really cause dry mouth. You may be dehydrated, you're not drinking enough water throughout the day, so we can start increasing your water intake to help relieve that. Something that we could also try is to stimulate your salivary glands. The best way is usually to use a sugar-free gum that has a strong flavor that helps to stimulate the saliva glands and produces the saliva to relieve the dry mouth. Make sure it's sugar-free, and it's always beneficial if it contains xylitol as well. One other thing you could be doing is breathing through your mouth all the time rather than through your nose. That can make your mouth feel very dry, and so if you train yourself to breathe through your nose rather than your mouth, that will help treat some of the symptoms you're experiencing. You could add a humidifier to your bedroom at night to help moisten the air, and that'll keep your mouth a little bit moister. You could even try an over-the-counter product like a biotin spray to help moisten your mouth and relieve those symptoms. If you really are experiencing long-term symptoms of dry mouth, and when you come into the dentist we notice that everything is very dry, we might prescribe you a stronger fluoride to help protect your teeth, or even make you trays that you can wear to help add minerals back to your teeth because you're missing those minerals from your saliva. And then the last thing we could do, which we don't try to do very frequently, but if you have a very severe case, then we'll even prescribe you a medication that will help stimulate your salivary glands and relieve those symptoms. So if you're suffering from a dry mouth and you have a lot of problems, try some of these things at home and see if it helps, but definitely contact a dentist and talk to them about having some specific treatment tailored to your needs.